Good afternoon, everyone. Welcome to today's program, Thinking Ahead, COVID-19 Considerations for Reopening Your School Campus. I'm Jennifer Hillen, NDOA's Vice President of Professional Development and Business Affairs. I'm so grateful to all of you for joining. And before we get started, I wanted to go over just a few housekeeping items so that you know how best to participate in today's event. At any time during the webinar, you'll have the opportunity to submit your questions to today's presenters. We got hundreds of questions from you ahead of time as well, and many of those will be covered in their remarks. But if you're not hearing an answer to a pressing question, please feel free to type your question into the Q&A at the bottom of the control panel here on Zoom. If you see a question from a fellow attendee that you would also like answered, let us know by selecting the thumbs up beneath the question. You're also encouraged to chime in with a comment or answer to the question with the comment button beneath it. One of the most valuable aspects of the programs like this that we've been putting on for schools recently has been the opportunity to bring you all together as colleagues to share ideas and solutions. As time allows, the presenters will address as many questions as they can during the Q&A session at the end of the presentation. We'll also be recording this webinar and we'll share the link and additional resources with you tomorrow. My hope is that most of our schools are now through the triage phase of the COVID-19 pandemic and how to address it this spring, such that independent school leaders are able to pivot to, and should be sooner than later, thinking about what the future holds. Reopening can mean a lot of different things, and I'm reminded of the importance of the rhetoric around the fact that while campuses may be physically closed, with the exception of a handful of boarding schools still housing some international students, our schools themselves are not closed, since you've done such an incredible job pivoting to distance learning and showing your value proposition. I know the thought of reopening campus for some may be too distant to fathom at the moment, and for others it may optimistically seem realistic sooner than later. There are a lot of implications for conversations around an individual school's plan for the future, both operational and strategic, and different scenarios that you should be modeling to account for a lot of potential variables. In the spirit of business continuity and long-term viability, we hope today's program will support business officers and other independent school leaders as you move into these conversations, decisions, and transitions well-informed. So without further ado, I'd like to introduce each of our esteemed speakers and outline what each plans to address today. The Honorable Dr. David Shulkin served as the 9th Secretary of the U.S. Department of Veterans Affairs under Presidents Obama and Trump. He is currently president of Shulkin Solutions, a consulting firm working with leading healthcare companies to innovate and improve patient well-being. Dr. Shulkin is also the former CEO of several prominent hospitals, including Morristown Medical Center in New Jersey, Beth Israel Medical Center in New York, and he's the former Chief Medical Officer of Temple University Hospital. Dr. Michael Jaff is currently Chief Medical Officer at a global medical device manufacturer and a professor of medicine at Harvard Medical School. Dr. Jaff is the former CEO of Newton Wellesley Hospital, a community teaching hospital in Newton, Massachusetts, and was GMP at Harvard Business School. Linda Johnson and David Wallowitz are familiar faces to many of you. They're directors at McLean Middleton and co-chairs of the firm's education law group. Linda focuses her practice on understanding and serving the needs of independent and boarding schools, including serving as general counsel for many of those. She's recognized as a national authority on student and campus safety issues, risk management, crisis response, employment law, and independent school law issues. David advises independent schools nationwide and internationally on all aspects of risk avoidance and crisis management, very appropriate for today. The focus of David's practice is the reinforcing of healthy school cultures which promote child safeguarding. David consults with schools on both prevention of and response to all types of educator misconduct. He's a pioneer in applying behavioral risk management concepts to promote healthy school cultures. Finally, Philip Hauserman leads the Atlanta office of the Castle Group. As Director of Crisis Communications, Philip advises clients on a variety of sensitive and highly charged matters, including discrimination, litigation, donor and funding issues, employment, Title IX and sexual assault, data breaches, and leadership misconduct, among others. In the last few weeks, he's supported numerous organizations, including independent schools, colleges, and universities, on their communication strategies related to COVID-19. Castle Group has partnered with nationally renowned medical experts, Doctors Shulkin and Jaff, to help organizations effectively navigate the complexities of this highly dynamic situation. Today's program will be broken down into 4 parts. First, we'll cover medical implications, then legal, followed by communication strategies, and then we'll end with a Q&A. First up with medical implications, Dr. Shulkin will present information on COVID-19, national guidelines and safety protocols, testing challenges, treatment, and vaccine updates. Dr. Jaff will present on medical considerations and precautionary measures for limiting transmission and keeping school communities safe, as well as best practices around diagnoses, personal hygiene, social distancing, quarantine protocols, etc. Linda will address some of the legal and risk management considerations in opening campuses, and David will briefly address some of the strategic considerations as your trustees and administration work together to make decisions. Philip will address best practices for communicating consistently, clearly, and effectively during and after the pandemic, including the important messages to convey around steps the school has taken and will take now and in the future. So at this time, I would like to turn the floor over to Dr. Shulkin to get us started. Thank you so much.
To MBOA for hosting this. I think this is an important topic that everyone get as much information on as they can. I think it's most important to remember that pandemics like the one we see now really are world-changing events. They change the environment that we live in economically, sociologically, and certainly the way that we practice in healthcare and the way that we go to school. There are generally about 4 pandemics every 100 years. But for most of us in our generation, this is our pandemic. We've not been through this, and certainly your children have not been through this before. The last pandemic, which you may not even remember, was about 2009 with H1N1, but it didn't impact people's lives the way that this one does. I think this pandemic is different for a couple of reasons. First of all, this is a novel virus, which you've heard before, which just means that humans have never seen it before. So there was no natural immunity, which just makes this extraordinarily contagious. And that's changed the way that this has impacted all of us. I think secondly, we haven't had a vaccine, so we don't have any way of stopping this at this point, but really our understanding of epidemiology of the way that viruses spread, and that's led to social distancing. And I think we've never seen social distancing across the world the way that we have now. And lastly, one of the differences is that most pandemics, most viruses hit children really, really hard. And are one of the sources of significant morbidity and mortality in children. But this one doesn't seem to impact children the same way, fortunately. But what do we know about how this impacts children? And, especially so many of you who are worried about your children. Well, it was first reported in China, as we all know. The first 44,672 cases were reported to China's equivalent of the CDC. And at that time, they just had 1 death under the age of 19. So that was really the first indication that we were going to see something differently. And just because we were somewhat suspicious about China's reporting, we've seen the same thing in Italy. In Italy, which, as you know, has been hit hard and done a lot of reporting, 1.1% of all deaths have been under the age of 50. So in children, again, very minimally impact in terms of certainly deaths. In the United States, now that we've had a chance to take a look at our own data, 1.7% of the infections now above 800,000 are in children. We've had 4 deaths here of children in the United States, unfortunately. What we do know is that children do get sick, they do get this, but they have much better diagnoses than adults. The infants are at the highest risk in general, or children with comorbidities or that are immunocompromised, either because they're taking medications or immunocompromised for other reasons like autoimmune diseases. Again, going back to China, 73% of children in both China and the United States had some type of symptoms, but in the Chinese population, they described the symptoms so mild that they described it as asymptomatic in the majority of Chinese children. In the US, where we've described it a little bit differently, 25% will have no symptoms at all, but those that do have symptoms have cough, sore throat, and fever. About 10% will have diarrhea, fatigue, a runny nose, nasal congestion. We also know that there's no real age or there's no gender preference. It's about half boys, half girls, around 56% boys, actually. Now, the reason why this doesn't impact children, we're still trying to figure that out, why it doesn't impact them in the same way. There are three hypotheses, but they're all hypotheses. One is that the enzyme that carries the virus into the respiratory tract is called the ACE2 enzyme. It's the angiotensin converting enzyme. And what we do know is that it differs by ethnicity, race, and also by age. And so the way children express this as they're growing, their lungs are developing, it just may not have enough ACE2 enzyme to really carry the virus in the way that adults have it. The second hypothesis is the cytokine response. Cytokine is when your body is really juiced up because of an infection. We think that can be very harmful. Children appear to have less of a cytokine response than adults. And lastly, there's a hypothesis that the antibody that develops with other coronaviruses, remember, the common cold is a coronavirus. There are literally hundreds of different coronaviruses that we as humans have seen. There's something about other antibodies of coronaviruses that actually can be harmful rather than protective. Children not having seen as many may do better. So those are the three hypotheses just to watch out. But anyway, let's go back to the virus itself for a second. We know it can be spread three ways, either direct contact as a droplet left on something, or airborne. And that originally wasn't thought to be airborne, but now that we do know it's airborne, which is the recommendation why people are wearing masks. And the virus is actually not a living organism. Most people think it's like a bacteria, it's living. It's not. It's actually just a protein molecule of mRNA that's covered by a protective layer of fat or lipid. And that's why it's so effective to wash your hands with soap, because soap is a detergent. It breaks apart that lipid layer, exposing the protein, and then it just degrades. It doesn't die, it just degrades. And so that's why washing with soap and getting a good lather of soap is important. Hot or warm water, not too hot so you don't burn yourself, is also effective since it's a heat-sensitive virus. Now, when's the virus going to end? That's the big question. And if you watch a lot of news, you may think that it's ending. It actually isn't ending. And so you have to look at the data, not listen as much to the politicians. We know that yesterday, there were 25,000 new cases of COVID-19 in the United States. That's a 4% growth factor. That means that we'll double the number of cases if it continues at the same rate, somewhere between 15 to 20 days. In Europe, the growth factors slow down more than the United States. It's a 3% growth factor, but we did 151,000 tests yesterday, still not doing a huge amount of testing, more than we have, but small percentage of the population still growing by 25,000. Scientists follow whether a virus is ending or when it will go away by what's called the RO, or the reproduction number. And that means that how quickly the virus is replicating to other humans. You have to have a negative RO. The RO has to turn negative in order to be able to feel confident the virus is now actually going away. Our RO today is not negative. It's about 1.5 to 1.7. So it still is growing, although there's evidence that it's slowing down and the growth is slowing down. In terms of the states where the growth is the slowest, Hawaii is the slowest, and then followed by New York and New Jersey. So even though there's lots and lots of infection in New York and New Jersey, that rate of growth is really slowing down, followed by Vermont, Nevada, Florida, California, all beginning to slow down. The states that don't have a lot of infection but are actually growing the fastest are states like Nebraska, Kansas, Arkansas, Kentucky, Iowa, Indiana, West Virginia. So you can follow these growth rates pretty easily. Go to the CDC site if you want to have a place where you can do that. Now, will the virus end in the summer? We certainly know other viruses do tend to end in the summer. This one may be different. Let's hope that this slowing is accelerated, the slowing is accelerated in the summer. But we do know that if you look at Brazil and Ecuador, very hot, the Middle East where it's warm, there is a lot of active infection actually with growth. So again, this virus may be different than what our normal expectations are. And what we do know about pandemics, almost every pandemic has a second wave. You heard the CDC director yesterday talking about a second wave may actually be worse, a scary thought. But second waves generally happen after the infection begins to slow down, even go away, then several months after, I'm talking 3 to 4 months after, a second wave often comes. So if it did go away this summer, which would be a good thing, a second wave may be expected in the late fall if it occurs. Again, this virus acts differently, but past pandemics have it. Finally, let me just end talking a little bit about the treatments. There are about 70 medications now being tested against COVID-19. We don't hear about them all. A lot of them are being done even outside this country. The ones that we hear about that I think are most encouraging are remdesivir, a drug that was developed for Ebola. It is an antiviral. It's in phase 3 clinical trials, with the results probably due towards the end of this month. And then the FDA will make a decision about that. So that could be available soon. It's an intravenous drug. You've heard a lot about the controversy about hydroxychloroquine or Plaquenil, the malarial drug. There was a study out that was released yesterday by the Department of Veteran Affairs, 368 people. It was a negative study. Actually, the group that got the drug did worse. So although people are criticizing the size and the way that the study is designed, it's something to begin to pay attention to. There are larger scale trials underway, and more data on that will be available. Convalescent plasma, this is the plasma that's infused from people who have recovered from the infection, appears again to be promising under study. So we'll watch that. Vaccine developments, there are lots of vaccine developments underway. The average time or the fastest that we've ever developed a vaccine has been 4 years. You've heard some estimations of it being 18 months by Dr. Fauci if everything goes well. I think that certainly is reasonable. I'm actually predicting it's faster than that. When I look at the trials that I see underway overseas and other places, I think that it may be quicker than that, but it's never been done before. So we have to be cautious. This pandemic really doesn't go away until we develop a vaccine. So that's important to watch out. Now, the implications for schools, schools will return. I have no doubt about that. And we will be able to do that safely, but it will not be exactly like it was before. As I said in the beginning, pandemics are world-changing events. Schools won't be any different. We're going to have active testing, both the antigen, the rapid test, and the antibody test. We're going to have to maintain some form of social distancing unless a vaccine is developed. And hygiene is going to remain to be important. Dr. Jaff's about to just talk about some of these things, which I think you'll learn a great deal about. And we've provided some more information that will be available at the end of this under schoolsafeplace.com, as well as my blog that I write on about this topic, shulkinblog.com. So if you want other information, it's there. And I think I will transition this now over to Dr. Jaff, or I'll hand this back over.
Thank you,
Thank
Dr.
you,
Shulkin.
David.
I'm so sorry, Dr. Jaff. Dr. Shulkin, just one quick question for you from the audience that I think may be relevant now. And Dr. Jaff, you may speak to it as well. When we aren't able to benefit from having world-leading health experts like the two of you on a program like this, as we move forward, someone asked, what health data can we request or monitor? What should we be looking at here to really know? I know you don't have a crystal ball. We don't know how long this is going to last, but how can we best stay informed? What should we be paying closest attention to?
Well, I'll tell you what I wouldn't do. I wouldn't listen to the politicians for my medical advice. But look, they're weighing a lot of different considerations, political, economic, and medical advice. And but I tend to rely upon the science. This has been such a fast, rapidly moving change of understanding of this virus that I believe there is much, much more that we're going to learn about how this is spread, how to prevent it, what rules are going to be coming out. I think that question is anticipating this, which is that this isn't one that you can just sort of turn off and come back a week later, because the whole story could be potentially different. So obviously there are sites out there that are more credible than others. Federal sources tend to be very credible sources. I also find them not very, they're generically written with very broad statements, so I don't find them quite as helpful. So you have to pick and choose your sources. But all I would say to somebody is, I'd probably try to confirm your sources in 2 or 3 different places if you're going to be making decisions based upon them.
That's helpful. Thank you very much. Dr. Jaff, would love for you to jump in now. Sorry to have interrupted.
Not at all. It's a great question. I'm with David. I think the CDC site's okay. Johns Hopkins has a COVID website that's actually very informative, and one that you can get updates every day on national and international trends. But I would agree. I think the best sources are those that are scientifically and medically and public health based, not economically or politically based. Not to state that the economics aren't important, but we're here today to help think about how to get kids back to school. It's really an honor. I also would like to thank NBOA for sponsoring this and for including me in this. It's been a real pleasure to work with David. He is just an amazing person with incredible perspectives. Let me just give you a couple of kind of shockers. So first of all, we've only known about this virus for a little over 4 months. 4 months. So when David says we're going to keep learning, we keep learning every day. For example, this morning, it was announced that the Food and Drug Administration approved the first ever home COVID-19 test done by LabCorp. It's called the Pixel, P-I-X-E-L test. It's a test where you can get it at home, use a nasal swab on yourself, put it back in the packaging, send it off, and get the results back. So that's how fast things are happening. 2 weeks ago, many people talked about hydroxychloroquine and azithromycin as the potential cure of this, to the point where people started taking this on their own. And now, as David said, a very challenging study, well-done study, suggests that it causes harm. So, we have to be very careful to remember we're 4 months into this, and we will continue to learn more. I want to make a couple of comments about how you can start to think about your own worlds of getting kids back to school. First of all, I have a personal vested interest in this. My 25-year-old daughter is a second grade school teacher in a private school in the New York City metro area. And so I can tell you, she is very eager to get back to school. So I've heard all about this from her perspective. I'll start off by telling you that the solution to getting back to school, just like the solution to opening up the country again, is clearly not going to be a federally run, federally mandated solution. In fact, I would venture to guess, and I think, David, we can chat about this during the Q&A session, it's not going to be a state-by-state process. It's not going to be a city-by-city process. It's going to be a town-by-town process. And the reason for that is twofold. One that I think makes a lot of sense, and that is the prevalence of the infection rate. Now, we're challenged because we're not testing enough. So we don't know the true prevalence. I'll give you an example. Just the other day, my alma mater, Mass General Hospital in Boston, presented a series of testing of 200 people who live in Chelsea, Massachusetts, just outside of Boston, a stone's throw from Mass General Hospital. And the reported infection rate was about 1% in Chelsea. Mass General tested 200 consecutive people in Chelsea, and the infection rate was more like 4 or 5%. So the more we test, the more we're going to understand about the prevalence of this disorder. But I think that's going to be a major driver to how kids can get back to school. It depends on where you are, where you live, and how overrun your regions are with the infection. So that's number one. Number two, it's absolutely going to be driven in some degree by the state and local legislature and their level of comfort. We've all heard in the last 24 hours, states like Georgia, and then towns within Georgia, like Athens, Georgia, who say we are not ready to open, whereas the state's getting ready. Other places like New York, New Jersey, they're not going to be as eager to open up, and the legislature there has already talked about extending the stay-at-home rate until middle of May. So I think a lot of that, the second thing is going to be the state and local legislature. Then the third thing is going to be, what's the urgency? So there are going to be industries and businesses that are going to have a real urgent need to reopen, not necessarily from an economic standpoint, although that will play a role, but more importantly, from a health, how important does society need them? And I would argue that this group that we're talking to today, there's a real degree of urgency. And I would look at it from a couple of perspectives. First is the kids' perspective, right? The kids are not getting the chance to interact, to learn social skills, all the things that you guys know way better than I know, that they're not getting on platforms like this. It's literally impossible for them to get it. And if they're particularly young, the longer they go without this, the more delayed their ability to develop those skills will be. And that could have a real impact on their development over the course of their lives. Secondly, from the parents, and I'm not talking about the parents going crazy trying to homeschool their kids, although that's clearly a factor. What I am saying is many parents can't go back to work if schools aren't open. And so that's a real issue for everyone to consider. So I would say that your constituency is one in which there's real urgent need to get back to some semblance of normal. So how's that going to happen? Well, if we had absolutely perfect testing to show if someone's acutely infected, that is, they actively have the virus and are very contagious, that could be really helpful, right? You would clearly say to those kids or those teachers or the associate staff, you can't be in contact with other people because you're clearly contagious. If we had an immunity test that could show with certainty that you have immunoglobulins in your blood that shows that you can safely be in contact with someone who's acutely infected and you can't get it, that'd be fabulous. We would then offer those tests to everybody if we had the resources to do it. I'm sorry to tell you that neither of those situations exist today. The diagnostic test, the nasal swab, and the point of care finger stick test do not have sufficient accuracy, in my opinion, to test an entire broad population. In addition, those tests were designed for people who are sick. They come in with symptoms, as David said, fever, cough, runny nose, shortness of breath. But to scan an entire population of well people to see if they shed the virus, there's actually a false negative rate that is really alarming. You could actually tell people you're not contagious, and in fact, they might be. Now, what about the immunity test? So it turns out that there are a whole host of issues here. First of all, the presence of an immunoglobulin, the actual presence, may not be enough. It may be the amount of the immunoglobulin you have that confers immunity. And so if you take a test that just says, yes, you have the immunoglobulin, or no, you don't, that may not be enough. In addition, the tests that are out there also don't have sufficient accuracy. You may be sending people back into the workforce or back to school with a thought that they have immunity when in fact they don't. Here's the hitcher to this whole story and why I think we need to think about a better strategy with what we have today to get kids back to school. The hitcher is this: even if you have sufficient amount of the immunoglobulin, does it confer immunity? If it does, how long does that immunity last? Well, we already said, we've only known this virus for 4 months. There's no way for us to know how much immunity and how long that immunity will last. Could it last a year? Could it last 2 years? Sure. Could it last shorter? It could. And so I think it's important to realize that there will be a role for testing, and we can talk about that more during the Q&A session. Understand that what you're hearing on the news and what you're hearing from some political figures is not actually based on the science that we have today. What I told you is, in fact, the science. So what could you do? Well, there are some basic concepts that I think we all have to think about when we think about getting groups of people back together in close quarters. First of all, as David so beautifully said, it is not going to be the same this fall as it was last fall or any fall before. You are not going to be able to presume that you can put 30 kids in a regular standard size classroom, let them interact to that degree, and then send them to the cafeteria to sit where they want to sit, and then put them out for recess to play with the same ball where they want to play. It's just not going to be practical, at least until we have a vaccine, as David said. And I agree, by the way. I think the vaccine story is going to be game-changing, incredibly fast, and never before seen. So I'm actually bullish, like David, about the future of the vaccine. But until that happens, you have to accept the fact that first of all, if schools are commuting opportunities where parents have to drive kids to school or buses have to take kids to school, you're going to have to think about having enough social distancing in those environments where carpools, shuttles, or buses can be done safely. That means you may have to run different times that you bring kids to school so that you're able to keep them separated enough to get to school safely and get home from school. Secondly, the density of people who work in a specific environment is going to have to change. You just cannot imagine that kids will sit next to each other in desks. There's going to have to be space, 2 meters. That's the general rule of thumb. It may be a little more, it may be a little less, but the general rule of thumb is going to be 2 meters or 6 feet. And so in order for you to do that, you're obviously not going to build new facilities right now. You're going to have to think about how redeploying your facilities will work. That might mean you've got to stagger schedules for those who work at your schools. You may have to stagger schedules for kids who go to your schools. You may have to actually think about redesigning the spaces that currently are not used for teaching to now become teaching-related places. And so these are all things that we can talk about during Q&A, but I'm sure you're all thinking about those things. I think the short term, and I'd love David's thoughts as we go to the Q&A about this, the short term is the central place for eating cannot exist. I don't think you can have a cafeteria that's just let for kids to go back and eat their lunch, get a snack. I just don't see that as realistic. And by the way, I would say the same thing about any other industry that's got a cafeteria for workers. I think you have to really think about ensuring that everybody knows what it means to disinfect. You can't wash your hands enough. The way David described it is correct. Obviously, hand sanitizer is important. There's got to be regular, scheduled surface cleaning. Particularly as kids are younger, we all know hands can be everywhere. These surfaces have got to be cleaned regularly and religiously, and there have to be enough availability of disinfecting wipes, et cetera, and people to do that. I think you have to think about staff meetings, personnel meetings, basically limiting meetings and gathering places. Break rooms, I think they need to be the same way as eating areas. It's going to be hard to allow people to go into a small break room in a group. And then, of course, I think there will be a need for testing in certain scenarios, which we can talk about. But in general, my sense is that all of these things, although highly disruptive, and none of us want it this way, this is the next normal, at least until the vaccine is available. And I think with that, I'm going to pause, and Jennifer, I'll hand it back over to you.
Thank you so much, Dr. Jaff. To the last point you made, this is the new normal until a vaccine is available. I know, again, we don't have a crystal ball. We don't know exactly when that is. I appreciate your optimism and Dr. Shulkins that it'll happen faster than we've ever seen before. When it does happen, I can't imagine that that's the immediate solution. Mobilizing and vaccinating an entire country won't happen overnight. So what do you think realistically that timeline and process looks like? Right now, we're just pointing to when it's available. But I think more realistically, we need to be thinking about what happens after that.
Yeah, so let me start off with, for good or for bad, I have no financial interest in any company that's developing a vaccine. So anything I say has no personal reference to me. I was on a call the other night with the physician who's leading the Johnson & Johnson vaccine program. So this is from the horse's mouth.
Okay.
They have a targeted vaccine. By the way, they're phenomenal vaccine makers. They know how to do this. They have a targeted vaccine that's going to start in phase 1 trials within the next 2 to 3 weeks. As soon as they begin their phase 1 trials, now listen to this, this is unheard of, at least for me. David, maybe you've heard of this before. Johnson & Johnson is committed to begin broad-scale manufacturing of that vaccine when they start phase 1 trials. That means they don't actually know the vaccine's going to work.
Wow.
But they are confident enough in this vaccine that by the first quarter of 2021, they will have 600 million doses of that vaccine. They also have a plan with a manufacturing partner to ramp that to 1 billion doses by the middle of 2021. That's really impressive. They also have 2 candidate backup vaccines should the first one not actually pan out. So they're thinking very deeply about this. And then, of course, as David said, there are something like 290 different clinical trials of drugs and vaccines that are in development, they're in clinical trials. How will this happen? Certainly, the population that needs protection the most will get it first. That's going to be healthcare workers, frontline healthcare workers. But I would argue that after that, getting key urgent industries back to work will get it next. And I would argue this is one of them. And so I would imagine, and David, I'd love your thoughts, I would imagine that schools, teachers, professors, administrators, staff would be very much on the high-end timeline to get this. So we'll have to see how it goes. Don't forget, by the way, there are a population of people who can't get certain vaccines, right? You know that someone on this call can't safely get the seasonal flu vaccine. Mm-hmm. You have an egg allergy, you've had a bad reaction before, something. So that's going to happen here. But this will result in a large population of society being protected, which will make the infectivity rate way down, the contagion rate way down.
Absolutely. That makes sense. That is really impressive. And even with as impressive as that is, you mentioned the first quarter of 2021, potentially into the middle of the year. So you're right. We are looking at this new normal for at least the next entire academic year, which gives us a lot to consider. In that regard, we're getting a lot of questions about that. I know we'll cover more during the Q&A, but just from a medical standpoint, I'm curious, when we do come back together in person, you mentioned the 6 feet of social distancing between students, et cetera. Do you think there's value in everyone being required to wear a mask? Is that realistic with younger kids? I know you may not be able to expound upon that latter part, but do you think that's what this looks like? People being required to wear PPE, and what if it's not available?
Yeah, so first of all, let me say that remember the top 2 things I said, and then I'll hand it over to David Shulkin. One is it depends on the prevalence of the virus in the region in which you have a school. Mm-hmm. If it's really uncommon, and if the rate of new cases is going way down, then it may not be required that everybody has to wear a mask all the time. But if you're in a hot spot, which really has not slowed down, and you want to get people back and you can make your case, I suspect masks are going to be needed. Secondly, your local or regional government's going to have some thoughts on this and likely will make a statement about this. But that's the way I would answer it in general.
Okay, that's helpful. Thank you. Dr. Shulkin, any thoughts on any of these recent questions?
Well, I think just in terms of that last one, that I think that I do expect that we will know more by the time that the schools are planning on reopening. But planning right now, I would say that if I were opening up a school, I would probably require masks for the first 14 days because the kids are coming in from all sorts of different people and spots. So I'd want to make sure that I'm very protective. But if, as Dr. Jaff said, if it looks like the school community has very little or no incidence of COVID after the 14-day period, then I'd probably be more willing to remove masks. If somebody is immunocompromised or on a medication, I probably, continue to have them wear a mask. And I do think that testing strategies are going to be important, particularly those with antibody testing, even though we're still learning about what the immunity means. That would give me more comfort about those kids not wearing masks.
Okay, that's helpful. We got another interesting question. I'm curious for both of your thoughts. Has there been any evidence to show that those who may have had the seasonal flu vaccine have been more protected as it relates to susceptibility with COVID-19 diagnoses? Are they?
No, okay. I don't think there's any protection from the flu vaccine. And all you have to do is look at our nursing homes. Almost all nursing home patients were given the flu vaccine, and they have not had that type of protection.
Good point. Good question. So we've had a lot of questions about boarding schools, and I will turn it over to Linda and David here in a minute, because I know we have the Q&A at the end, but I think this is particularly relevant to the medical components of this with travel. We've talked a lot about, of course, international travel, but domestic travel as well. And boarding schools in particular are dependent on people traveling from all over to their campus. What specific medical implications are there with travel as we look at what the future holds with this? Is there anything those schools should consider that may be different than your regular day school down the street?
Well, go on, Michael.
I just typed an answer to someone who stated that my comment was not relevant. I actually think my comments were very relevant. Let me just clarify. If you have kids coming from different regions of the country, this goes exactly to what David said just a few seconds ago. Particularly if a kid's coming from an area where the prevalence of the infection has been high and the number of cases is not going down, that's somebody, you'd want to test. I think that's entirely reasonable. And most likely, if the kid's completely asymptomatic, you may have to quarantine that kid for a period of time before the kid's allowed to go more broadly into the local society of the school. But I think the concepts around prevalence of the illness, state and local government recommendations, and the decisions around testing and PPE will remain relevant across the board here.
Absolutely, that makes sense. A really great question here to the point about social distancing continuing. What about experiential activities that schools rely on, such as athletics? It seems not viable if people have to stay 6 feet apart, but certain sports could continue, for example, and that's relevant to summer programs. A lot of you listening in are asking about summer programs. So I think you can consider whatever their answer is here, consider it in light of summer programs and your regular extracurricular activities at schools. What are your thoughts on things like that?
I think you're going to have to look at every situation differently. I think that boarding schools are going to have different considerations than people that are going home every day, being exposed to their families who may be exposed to dozens of people at their work environments. So I do think that you have to expect, as we've said several times, that this won't be exactly the same, but I do think that we will find ways to make sure with screening, with testing, with antibody, presence, we will find ways to get closer to normal than what we're experiencing now. But it's going to have to be almost individualized to figure out the sport and the location where you work, or, the location where the school is.
Great. Thank you so much. Without further ado, I would love to bring Linda and David into the conversation. We have a lot more questions, medical and others, that we'll try to cover at the end, but let's talk some about the legal and risk management components of this. Linda.
Right. So to make it easier on folks, have done a PowerPoint, which NBOA will make available so that you don't have to take any screenshots of this. But the legal and risk management considerations, sort of developing your roadmap to reopening, I think as we've heard from the doctors, looking ahead, there's still a lot of unknowns. And I did read through the many hundreds of questions that were submitted before and hope to touch upon many of those. Questions on looking ahead for the fall is, will you be back on campus or are you going to stay remote or both? What about the day versus the boarding school considerations? Will you follow what is mandated for public schools or not, and why? What are you going to do about visitors or open events? Or are you going to live stream your events? And as we've talked about, what about athletics? In the past, schools often did community letters, and now I'm seeing community videos, trying to maintain that human contact with your community students as well as parents and employees. And what have we learned from essential businesses that have stayed in operation? You know, they've done things like no self-serve cafeterias for the time being, wearing masks, limiting meeting size. And how do you handle the employee who's simply afraid to come into work? Do you have a staggered return? And if so, what is the criterion that you use for coming back to avoid inadvertent discriminatory decisions? One of the frequent questions is, do you use waivers when you return? We actually ran into this issue already when you had some parents of international students who indicated they did not want their students returning to their home country, and could the boarding school keep those students? Many of the boarding schools said yes to those parents and reached out to us and said, should we have a waiver? Their concern was, how could they guarantee that they were a safe place and that that student would not get COVID-19? So we did do some waiver drafting for those situations. In the remote learning environment, many schools don't really have the online recording permissions that they need. They might have some permissions, they might have some copyright considerations, but you want to take a look at that. And even for this year, what about the payment of room and board if the school doesn't return to campus next year? Parents are looking for the assurances to say, well, I'm going to sign up for my student to go to your school. But what happens if you don't really open and you continue remote learning? And that question is one in of itself. There are a lot of existing enrollment agreements where they do have force majeure language, or language that would address that. So as you can see, those are just a few of the many questions. The dialogue has begun, and the time for thoughtful planning is now. Overall, from your legal obligations, you need to follow what is going on out there. The laws, the regulations, the recommendations, and the guidance documents. As the doctors have said, there are federal, state, and local health authorities that are coming out with information. There are the existing Anti-Discrimination, Americans with Disabilities Act. There are some non-mandatory recommendations, the Centers for Disease Control, and legal compliance documents such as from the EEOC. One major caution for all of this is a rapidly changing situation. Almost daily, there are new guidance documents, changes in past guidance and interpretations of the law. One of the very first questions that I got when this whole situation began to evolve was a head of school who called and said, Linda, can I take the temperature of my employees? Now, this was before the international pandemic was declared. So researching that question, the answer then was no, it would be a violation of the ADA. Taking someone's temperature is doing a medical examination. And unless there was an immediate threat to the community in which the school was located, it would not be acceptable. And so the answer was, in that particular community, a remote community where there was not a lot of incidents of that, it was not possible based on the law and the EEOC's guidance. Well, then it was changed. There was an international pandemic, and the EEOC has since changed its guidelines to say, yes, you can take their temperatures, and the CDC and many other health authorities are saying, and you should take the temperature of the employees. So again, we're gonna have to keep up with that. How does that change? Once this settles down, will it go back to, no, you shouldn't take their temperatures? Or questions. In the past, you could not ask incoming employees, new hires, and about their family members or themselves, like, do you have a cough? Do you have a fever? Do you have these symptoms? Because it was a violation of the Americans with Disabilities Act. Now it's, you can ask those questions, you should ask those questions. But here again, is that going to change? Now, you've probably all heard, and maybe not fully digested, at Thursday, the federal government came up with opening up America again. Now understand these guidelines are not directives. The states, the governors have each issued their own emergency orders following this COVID-19 situation, but it does provide us, the schools, with some direction about what are the pragmatic things we should be doing, such as the questions being asked. Once you get through the gating criteria, that is some downward trajectory of the COVID symptoms and cases over a period of time, you then get into 3 different phases. And what is helpful is, although it's general, they do provide these guidelines to say, here are the things you need to think about, among them being the continuation of social distancing, the use of disinfection. Do you have some travel restrictions? What is about the protective equipment? Do you have that? Do you have masks? Do you have those available? Even testing, isolating, and contact tracing. Now, our schools have never really done contact tracing before, but it is something we're going to have to do. And again, the temperature checks. For all the phases, unlike in the past where a lot of this would have not been allowed under law, you should monitor your workforce for any indicative symptoms of this. You should say, sick people stay home. How often have we ourselves or perhaps seen co-employees coming to work with severe flu or cold-like symptoms? We can no longer allow that. And then developing and implementing the policies and procedures for workforce contact tracing. Now, you've probably heard that Partners in Health has partnered with the state of Massachusetts to do contact tracing, which, by the way, my daughter is working for that project here in Massachusetts. And you're going to have to look to see, how do we do that, and what is it that we can do from a workforce setting. I'm not going to go into all of this because I have limited time, but I did want to go through that. For each of the phases, there are recommendations for individuals as well as for employers about what they should do. And you'll see as it goes forward that they relax a bit. Right now in phase 1, it's, no more groups of 10 or more people, minimizing non-essential travel, considerations for vulnerable individuals, the elderly and those with underlying health conditions. As to employers, encouraging telework, perhaps returning to work in phases, closing common areas where people are likely to congregate, enforcing the strict social guidelines, and again, non-essential travel and accommodations. In phase 1, the federal recommendation is schools who are closed should remain closed. Now, at least in New Hampshire, the K through 12, pursuant to our governor's emergency order, were deemed to be essential. So they continue to be open where especially there are students present. I did list some of those specific types of employers. So again, that you can look to see, although it says sit-down dining, movies, sporting venues, places of worship, many of schools also have that. In gymnasiums, what is it that is being recommended out there for the safe protocols to follow? Phase 2, again, you'll have these slides, but again, you'll see a further relaxation. Okay, social settings of more than 50 people. Non-essential travel can resume. Still encouraging teleworking, common areas, special accommodations for the vulnerable population. Now schools can reopen that had previously been closed. As Dr. Shulkin just said, though, that may change. It may be deemed that the governors in particular states will say, no, schools are essential and should reopen at a certain time. As to individuals for phase 3, again, a further relaxation, continuing to say that low-risk populations should minimize time spent in crowded environments. We have heard that you might be a carrier and not know it, and certainly the exposure to others who may have that. And then finally in phase 3, unrestricted staffing. So again, although they're minimal, they're quite generic, it provides some guidelines. Face masks, as the doctors just said, if a school were to open in the immediacy, you would be wearing face masks. At our firm, which is an essential firm to help businesses and schools stay in compliance and understand, what their responsibilities are for COVID, we might work in an office, but with a closed door. When we go out in the hallway, we wear a mask. Making those decisions that is indicative to your environment, where you are, locale, and what the incidence is. Currently, CDC recommends wearing cloth face coverings, as well as the link down below where New Hampshire just did the same thing. The EEOC is also someone that you should follow. They have exceptional and excellent Q&A information about it. A lot of the questions that you had. Can I take the temperature? Yes, you can. Can I ask them these questions? Yes, you can. and it changes. It was last updated April 9th and last updated April 17th. So they are constantly updating it, trying to provide very helpful, useful information for that. One of their questions during a pandemic, you can ask someone who calls in order to protect the rest of the workforce. Can you take the body temperature? Past answer used to be no, now it's yes. You should be aware, however, that someone who does not have a fever may still have COVID-19, so it's not a guarantee. Can you require employees to stay at home if they have symptoms? Yes, you can. Can we require return fitness for duty? Yes, you can. Now, some of the other considerations that schools need to do is who can or should continue to telework. The disinfecting procedures was one of the questions that you had. How do I disinfect my school? What do I use? And I have a link towards the end of the PowerPoint where the CDC has exactly those guidelines, what to do to the school environment, and also guidelines on what are the kinds of products that you can use that are helpful. Schools will need to consider health considerations. You know, what about self-reporting of that? What about personal hygiene, ongoing reminders of what is required? What are your own health center capacities and your local health provider relationships? The waiver and releases, you know, can we ask for that? No, we can't guarantee that a student or employee will not get COVID. Yes, you can. We have heard about changes to enrollment agreements and employment agreements, force majeure clauses, a lot of work being done about that. Your handbook policies, do you have a contagious disease policy? What do you need to put in there? What will you change about your trip and travel policies? Do you, even if we fully open by the fall, continue some form of online learning, even when the campus is open, so that your students and employees will be more adept at doing it? All of the employee considerations, compliance with wage and hour, restructuring, change in job duties, morale, to meet the needs in this developing area as you come back. Food services, as the doctor said, open cafeterias, no longer having self-service. How do you manage that? Athletic events, meetings, functions. If you accepted the Paycheck Protection Program funds, schools will have to deal with the issue of compliance with federal laws and regulations like Title IX until that loan is paid off or forgiven. I'm not going to deal with communications, but throughout this process, communications is key to all of this, and Philip will do that. But let's not forget, I know I'm talking fast and trying to cover a lot in a short amount of time. We have to layer all of these considerations with your mission, values, compassion, and caring. That is what your hallmark of it is, that independent school is an education of the whole person in a caring environment. So we need to maintain pragmatic optimism and know that what is good endures. For your benefit, I put in what hopefully are all live links that answer many of the questions addressed. Guidelines on playgrounds, sports activities, disinfecting your school campus, travel advisories. These things are constantly being updated. A lot of things particular to the school environment that you would find helpful. Are the good resources? NABOA is doing a great job with its resources and webinars that it records and makes available to members. NAAS, the same. Regional school associations, law firms like McLean Middleton, but also Venable, Fisher Phillips, and others have really good resources if you go there. Keeping up with all of the either federal agencies or departments, and I think I left out OSHA. I did find two very helpful things in my research for today. One was the Return to School Roadmap and Opportunities Labs initiative. When you're saying, what are the pragmatic things about my school? It gives you food for thought on things like facilities, governance, instruction, technology. And the best one that I've seen is the Safe Work Playbook created by Lear. Now that is a manufacturing operation, but they put it online and it covers everything. And I have to tell you, it has things like, what do we do about social distancing during our lunch break? What do we do about bathroom usage during our workday and our break times? What do we do about social distancing in common areas? As the doctor said, recommendations for, although they recommend individual commuting, which is preferable, when you need to have some form of other transportation, things like bus drivers must always wear a mask. Temperature checks must be done on all bus drivers before the start of their route and documented. but really a treasure trove. And like lawyers, they have a disclaimer that says this may not apply to everyone, and we make no assurances that what is here is needed. You need to tailor it to your environment. And last but not least, as a lawyer providing information, I have to say what I'm saying isn't legal advice, it is guidelines. And as I stated at the outside, please monitor all of this on an ongoing basis. And I'm sorry I spoke so fast, but I did want to cover as much as I could responsive to the questions that you had.
Thank you so much, Linda. Two questions for you, and other presenters may want to chime in here. From a legal standpoint, can schools and should schools consider putting travel restrictions on employees and/or mandate disclosure of travel, for example?
I think the answer to that is yes. And I think that schools that are continuing in operation with some, even just a few students, have already done that. And we've come up with some questions that you can ask about that you should ask about that, because you're trying to protect your communities and the greater community, and it is acceptable to be able to ask those questions.
Okay, that makes sense, especially as a paid employee of the school. What about a student or family? Would the same answer apply? Are they required to disclose something like that if the school is allowed to ask?
And here again, I think the answer is yes. I think these are unusual times, and you have to think about what are you doing about your visitors on campus? Anyone who's coming in, parents for drop-off, how are you going to do it? I can't say I know the answers to all those questions, but I think the planning for that is now, and especially students coming back to live in the boarding school environment, but even for day schools, if you have day schools, to say, in these times, here's what we're requesting of our families and of our employees and of our students. And it's going to change as we see what happens in the coming months. And again, as things loosen up, and if there is a flattening of the curve, or as the doctor said, a vaccine or immunology where but those are the things you need to be thinking about. And there may be, like, if it was right now, you'd want to be asking those questions to know, is it safe to let this person on campus?
Absolutely. That makes sense. One more question, and it could be a good transition to David as well. But for either of you or any other presenter, what is the school's liability if they follow all this protocol and decide to open campus, they're disinfecting, they're following best practice, and someone in the school community becomes infected and maybe puts others at risk? Is the school at risk of a legal threat there?
Let me jump in and say, and I'm just going to say this quickly. You asked a great question, but in that question, you used the term best practice.
You're right.
Schools are not held to be legally liable for failing to follow so-called best practices. Schools are only held legally liable for failing to follow the standard of care.
Yeah.
So it is a good segue to what I'm going to say, which is if schools go to the resources that Linda mentioned and that Dr. Jaff and Dr. Shulkin mentioned, and specifically if they hire consultants like Dr. Jaff, Dr. Shulkin, and others, it would be difficult for and then they follow their advice, it would be difficult for someone to claim that they weren't following the standard of care. And let me just quickly say, because I'm often an expert witness as well as a lawyer who advises schools, the judges always say in trials, perfection is not the standard. Mistakes do happen. You can't guarantee safety and results. All you can do is guarantee that you follow the minimum standard of care. So that's my quick answer.
I think that makes perfect sense. And maybe when we get to the general Q&A, we can expand a bit upon what that standard of care should be, because I know it's not necessarily the same school by school and will continue to change. But thank you. That's a great point. So David, this is a great opportunity to turn it over to you to continue with your remarks, and then we'll follow up with Philip. Thank you.
Well, thank you. I'm going to take this conversation to a macro level from the micro level. I understand that everyone's focusing appropriately on and listening attentively to the details of how to reopen the schools. I want to talk about the strategy and the planning of how to reopen the schools. And the problem is, as you've heard, that there's so many variables that are unknown. Obviously, the medical and healthcare variables are unknown to a certain extent and will become clearer and clearer over time. But this is a social crisis. It's not just a healthcare crisis. And part of that social crisis is that it's an economic crisis. And I think it's fair to say, while we can't predict much, we can predict the greater the severity of the economic downturn, the greater families will cut back on discretionary expenses. And families who are struggling and looking at cutting discretionary expenses, who have kids in independent schools, are going to quickly realize that their largest discretionary expense is likely to be the tuition. So one way they can save thousands of dollars if they're under tremendous economic stress is to send their kids to public school. So the reality of this immediate threat to independent schools is that the more severe the economic downturn, the more enrollment and revenue are likely to fall. And for some independent schools, that means that this is potentially an existential crisis. And certainly for the majority of schools, and I think both Dr. Jeff and Dr. Shulkin said this, we're facing a new reality, and that new reality is going to be a new economic reality, and it's going to change permanently the way schools operate. No administration, no administrator, no business manager, no head of school should face this crisis alone. They need all the support they can get, and now is the time for them to get that support, and the support that's available to them and has substantial knowledge and time and energy to provide is the board. The question is, how do boards and administrations work collaboratively in a crisis so that they're productive and not dysfunctional? And I've got some articles that I posted about this previously. NBOA published an article on this. And when I wrote the article, "A Crisis is Coming, Is Your Board on Board?" I did not have a pandemic in mind. But nonetheless, the points are the same. And one of the key points is the time when it's most likely that dysfunction will rear its head between a board and the administration is during a crisis. And we want to avoid that. And now it's more important than ever to avoid that. So how do you help boards and administrations work collaboratively so that boards can support the efforts of the school, of the administration? First, it's really important to understand how their roles differ. The board's role is to provide oversight. The administration's role is to manage. And it implements strategic directives from the board, carries out the school's mission and the vision. The board does this through inquiry. It gathers data to review performance, to adjust strategies, and to generate strategies going forward. Another really important distinction, and I think schools must have felt, been involved with this distinction when the government financial assistance was available, is that unlike the administration, the board has fiduciary obligations that include protecting the financial stability of the school. They have legal obligations to do that. Keeping these distinctions in mind will help avoid the blurring of roles. Secondly, the school needs to have mechanisms for collaboration. I'm certain that almost every school that I'm working with and that Linda's working with already has a crisis response team in place. They created those teams for other purposes, and this has triggered them. Those teams have been focusing on managing the shift to remote learning. And let me say to all of the people on this call, God bless you for the work you've done. I cannot imagine how in a week's time or 2 weeks' time you shifted without any expectation from in-person education to remote learning. You deserve a tremendous kudos and congratulations for that. But managing the school in a crisis is such a significant challenge for administrators that it's almost a full-time job by itself. And meanwhile, the administrators need to do their regular full-time job because you're still running the school and have all the regular issues. So the question is, how do you get assistance? Well, the board can provide you that assistance. It can develop strategies, but in order to do that and to provide support, it needs to have a response team. Most boards from most schools are pretty big, and a large board isn't going to be nimble or effective in this crisis. That's not to say they shouldn't be involved. Absolutely, they should be involved. But I recommend that the board create a crisis response team itself to focus on long-term strategy, financial viability, and that the two-term teams should work collaboratively and regularly on developing, addressing, and carrying out these strategies. In particular, right now, every school should be modeling, and the boards can help with this, how they're going to operate in the event of a substantial drop in enrollment. How long can they continue to do that? We don't know, but you have to plan for it. Excuse me. Finally, to succeed at strategic planning, these teams combined will need to have a clear focus. In my opinion, surviving this economic crisis will require independent schools to protect the core elements necessary to the continued successful operation of the school. What are those core elements? Pretty easy, in my opinion, to identify: students and employees. You need both groups to survive. Protecting the core will require a combination of effective strategic planning and effective communications. And this economic downturn, independent schools are at a clear disadvantage to public schools because of cost. But public schools must reopen and operate pursuant to schedules and regulations by school districts, public authorities, and to some extent by politicians. Private schools, on the other hand, can be more careful and can be more creative. This could be your differential that helps you survive and weather this crisis. Parents, of course, want a good education for their children, but right now, I would say to you, what parents want the most, what they value the most, and in my opinion, if able, what they will pay for is keeping their children as safe as possible. So independent schools can demonstrate their added value by focusing on strategies of safety. I recommend that you work with qualified public health experts, such as Dr. Shulkin, Dr. Jaff, to plan these strategies. But if you want to get a bang for your buck, communicate these strategies then to your key constituents. That will be critical in demonstrating the value of the school. Not just families, but employees are going to need reassurance that it's safe to return to school. Creative strategic planning and effective communications will be essential to protecting your core in this downturn. Thanks.
Thank you so much, David. If you haven't already read the article David referenced that we posted, we'll be sharing that and a lot of other resources. We could and likely will do a lot more just around that topic alone, what the role of the board is here in partnership with leadership as we think strategically in the long run. So more to come in that regard. But last but not least, I want to invite Philip into the conversation because no time has this been more important than it is right now to communicate your value proposition, appease the understandable anxiety that everyone in your school community is feeling, and look toward communicating the decisions you're going to make to transition into this new normal. So Philip, please talk to us a little bit about that, and then we'll have time at the end for Q&A.
Thank you, Jennifer. And I've got an eye on the clock, and I want to leave time for Q&A with the doctors in particular. So I'm going to go through this fairly quickly. Best practices for communicating clearly, consistently, and effectively. As you can tell, there's lots of questions. If you have them, and your students, your parents, your faculty, your staff have them, there's changing guidelines on a daily basis, almost daily basis. It's incredibly important to consult with reliable, fact-based, and accurate information. And that's why it's been so helpful for consultants like us to work with medical experts like Dr. Jaff and Dr. Shulkin to not only help inform communications, but also to inform short and long-term decisions that the school will need to make. Dr. Shulkin mentioned earlier managing expectations around the new normal. It will not be as it was before, but that doesn't mean it can't be an effective environment for learning and growth. And as Linda mentioned, communications is key. The summer will not be, extended summer I should say, will not be as quiet as normal, but nor should it be. Your stakeholders are looking to you for leadership. And then David just finished talking about strategies, planning, and process for the future. I really think that started weeks ago. How are you communicating? So as you've undoubtedly found over the last couple of weeks, it's incredibly important to have regular touch points around multiple points. Health updates, medical guidelines, government orders, how they affect your school and your community. More recently, closures, cancellations, and postponements as it relates to classes, graduation, summer, travel, athletics. Now questions are coming about the 2021 school year. The protocols and precautionary measures you were taking before school closed, but then as part of that, health, sanitation, personal hygiene, social distancing, both now and in the future. In each one of those communications that go out, it's important to deliver consistent messages and updates that, number one, demonstrate leadership and a firm commitment to your school and your community. Express empathy, sympathy, and support. This is a very difficult time that everyone is going through together. Reinforce your policies and procedures, outline your plans and expectations going forward, and making sure that everything aligns with and supports your short and long-term objectives. And to all your audiences, really, you should be relaying the same basic message to everyone: faculty, staff, board, students, parents, prospective students, alumni, donors, local community businesses, officials, media, etc. And as Linda talked about, multiple media. I mean, I think we've all relied on community letters. There's been more newsletters. There's been more video messages that I've seen that I've helped draft. Using your website, using social media, using the technology that we're all using right now with virtual all-school meetings or with town halls, how effective that can be to answer questions from your constituents. But also being careful to consider pace and cadence. I think if anybody, opening even your personal email, the volume of email that everyone is getting from every business, every association that you're a part of. So be careful not to under-communicate, because under-communicating leads to speculation, rumor, and risk. But at the same time, be careful not to over-communicate, because it can unnecessarily cause concern and lead to increased scrutiny. What I would say is create, if you haven't already, a structure for expected updates and communications to help manage your community's expectations around when they expect to hear from you. Do this fast, consistent, honest and authentic, with compassion, but also with confidence and optimism for the future. So I would say, and I want to turn this to everyone for Q&A, because I recognize the doctors are the primary pull here. In preparation for reopening, reiterate all the messaging that you're going to put out this summer and the steps you've taken to enhance your community safety, health, and well-being. That should include new protocols and precautionary measures, much of which you've heard Dr. Jaff, Dr. Shulkin talk about. New health regulations, new health screening processes that you might be implementing, any changes and adaptations for the day-to-day, and that includes classrooms, workspaces, cafeterias, athletics, and how you're going to regularly clean and disinfect those areas. Make sure you have resources available to students, faculty, and staff, and that includes mental health. That is one aspect that I've seen in particular in higher ed. Administrators are concerned for the mental health of their students and also faculty and staff. And then making sure that throughout all this, there's an extreme commitment to confidentiality. So I went through that in about 6 minutes. I'm sorry if I talked fast, but I recognize that there are questions that continue to pour in. So with that, Jennifer, I think open up to Q&A.
Yes, definitely. Thank you so much. I realize that 88 minutes have flown by really quickly, or excuse me, 78 minutes at this point. So we will do our best to end on time. I know some panelists can stay on after, and understandably others cannot. So either way, we will keep going to the extent that we can. We're recording this and we'll share it with you after. But in the interest of having the doctors with us right now, I did want to start with a couple of medical questions first. We got an interesting one from an audience member regarding whether the vaccine is expected to be a live vaccine, sort of like the shingles vaccine is. She works at a special needs school, and many children have autoimmune diseases there and can't safely have a live vaccine. Do we have any sense yet of what the effective vaccine will be like in that regard?
There are many vaccine trials, and they're trying different types of technologies. The technology that would get us there the fastest has never been done, and that is really a mRNA vaccine. And as I've said before, this is not a live vaccine. Mm-hmm. This is really just a protein that does stimulate a antigen antibody response, which is how vaccines work. So the reason for doing it that way is it is believed that it is a quicker path towards a finished product. So if that does turn out to work, then no, that would not be a live vaccine. But again, it's not tested technology.
Right. Okay. Understandable. Thank you so much. So we've talked a lot about the standard of care, and it seems like if we can adjust to a new normal, we may be able to see ourselves physically back on a campus before a vaccine is available. That's going to require a lot of adaptation from how we operate currently. So what is that standard of care? And maybe we should start with the medical response first. What do we need to do to protect our community? You talked a little bit about this at the beginning, but we come back to school, it's totally disinfected. What if someone becomes infected again? What does the school need to do to clean up and sort of mitigate any fallout from that? What are the best practices there? I shouldn't say best practice. What is the standard of care? My attorney here will advise me to use that phrase.
Well, let me start, and then I'll turn it over to David Shulkin. So first of all, I learned a ton from listening to Linda and David. So I actually would love to hear their answer to this.
Yes.
Let me start off by reminding you that we're 4 months into this. So there really is no standard of care that we can bend on because we haven't seen this in our lifetimes. Mm-hmm. But there are some categories of things that I think will be required. You got to think about before anybody actually gets to the campus. Kids, teachers, support staff, environmental services, food service. You got to think about how do you reassure yourselves that they're as low risk as you can. So I think that's category one before you ever enter the place. Secondly, I think you have to think about the physical structure. And I mentioned earlier some of the things you have to think about from how the desks are set up, where people can eat, where congregants can actually happen. Airflow could be an issue. Obviously, sports, locker rooms, bathrooms, I mean, all these things. So that kind of goes into the physical place in which people are going to interact and live. And then I think you've got to think about once kids are on the campus, in the classroom, in the schools, where are they physically? What protection mechanisms are they being insisted on using? Distancing, hand hygiene, surface cleaning, masks, etc. And then I think you really got to think about kind of the disaster scenario. Someone gets it. Someone gets sick. How do you manage that? That can't be an on the spot, oh my goodness, what do we do now? Right. So David, what other thoughts do you have about what could the standard of care look like in this type of environment?
Well, I think everything that you said is part of it, but I think then you need to think about screening protocols. You need to think about diagnostic testing, the antigen antibody testing, and you need to think about, as you said, what do you do when somebody starts developing symptoms? What protocols do you have for referring them for care and isolation practices? And if drugs are available at that point, you know, what may be reasonable to recommend. Fortunately, children, as we've said before, don't get this nearly as bad as adults, but it doesn't mean that you don't have to worry because we have seen deaths in the United States.
Right. And we do have a lot of adults on our campus as well. It is comforting, though, to know that about younger age people. So in that regard, you know, we can practice social distancing, physical distancing in the classroom. We mentioned that the cafeteria of old should not look the way it does going forward. What about again, with residential life, this is trickier. People are sharing bathrooms. Shared bathrooms are an issue for any day school as well, but a little more tricky for boarding schools. What are some things they should think about there or advise students to consider?
Well, I do believe that people are going to have to know the testing status of who they share rooms with and bathrooms with, and they're going to have procedures for identifying early potential concerns about infection. Although, as we all know, this is spread as an asymptomatic disease, and that makes it extremely difficult, which is going to make antibody response and knowledge more important. So I do think every school will need to have protocols developed on what they believe is going to limit the risk the most, but there's not going to be any assurances until there are vaccines out.
Right, absolutely. And in that regard, as you can imagine, a lot of participants on this call and others who weren't able to join us today are thinking first about their summer programs that they had planned. I think most schools have already understandably decided they won't be back to campus this spring, but summer's right around the corner. Our schools depend on this revenue, communities depend on this childcare. Do we think, honestly, that it's viable for schools to offer any sort of summer program, or should we really be pivoting to looking at the fall or maybe 2021 for reopening any sort of on-campus environment for our communities?
Well, I typed an answer while you were chatting, but I'm sure David hasn't seen it, so I'd love to hear if he agrees. David Shulkin, do you think a summer school or summer camp program could happen this summer?
I think there are some parts of the country that you would be able to do it. We're watching right now, and it's not the same, but it's offering a model of reopening up of elective surgeries for hospitals. And while you say New York, Michael, this is sort of your point earlier, while you'd say, well, New York would never do that. Well, Governor Cuomo has already announced that he is planning on allowing elective surgeries in 17 counties. Now, all those counties are upstate New York. They don't include Albany, and they certainly don't include any of the downstate near New York City counties. But on a county by county basis, on a location, if it's not widespread in your community, you have 2 weeks of decline of the disease itself. You have assured yourself that you've gone through the checklists and the appropriate practices that essentially meet a standard of care, and you do appropriate screening of your students and your staff coming in. I do think that it is realistic in some areas to consider summer programs. I probably wouldn't consider contact sports programs out of caution, but I do think that there are other activities that could be appropriately done with the right counsel and advice. And again, that's why, I think people have said that all along. This is where you get experts to help you do that, and programs like free, schoolfreespace.com and other materials that will be available on your website, I think will be helpful for people to consult with.
Jennifer, let me just jump in and say to the business managers and administrators who are listening, I don't think the risk of lawsuits, or at least successful lawsuits, will be substantially high or higher than usual, so long as you document what you do and you follow the advice that you're hearing from these experts. So if you do test, keep records of the tests. If you if you follow government guidelines, keep copies of the guidelines and demonstrate that you followed them. If you, and so forth. The record keeping element is going to be really important, because a jury, if it ever goes to a jury, isn't going to look at this till 3 or 4 years later. And if they think that you followed what best available advice, even though people didn't know what the answer was and something bad happened, they're not going to hold you liable.
That's really, really great advice. I know that some of you have to jump off. I wanted to ask one more quick medical question before we lose Dr. Jaff or Dr. Shulkin. Someone understandably said, you know, we're hanging our hats on testing quite a bit here, and yet testing is not widely available. Do we expect that to change anytime soon?
Yes. Yes.
I do too.
Yeah. I mean, we're not going to sound like, again, some of our politicians that say that anybody can get a test. As medical experts, we know there are many, many people out there that have tried to get tests and they're not available. But I do believe that that is beginning to change. And if we talk about a summer school program, I do believe those types of testing should be available in the area. And, you know, schools will partner with programs that can do that in some cases. But that should, each day you should get better at being able to get access to it.
And the only thing I would add to that is, it seems like every day another test gets emergency use approval. Like I mentioned this morning, the LabCorp home test. I would not be surprised if we saw a marked proliferation of FDA-approved testing that could be point of care, used in a school environment, and safely performed.
Okay, that's great. That's comforting to know. Dr. Jaff, I know that you need to leave us, and I think Dr. Shulkin already did, but I just want to give a huge, huge thank you on behalf of NBOA and everyone listening. I know that Linda and hopefully some others can continue for just a few more minutes, at least with Q&A. But since this is the formal end to the program, we will keep recording. I would be remiss if I didn't thank you all so much for this incredible hour and a half and all of the expertise you've shared. So thank you.
Thank you very much, and best of luck to everybody.
Thank you, Dr. Jaff. To continue with the Q&A, a question for you, Philip, that I think is really interesting, and I know that David and Linda will have thoughts here as well. From a communication standpoint, this is an interesting question. How transparent should the board be right now, especially in a time where we don't have the answers yet? I'm sure there's a balance to be found. Should the board announce the formation of their crisis committee, for example, or the work they're doing behind the scenes? What would your recommendation be?
Yeah, I think it is a appropriate balance. You have to a fine line to walk, but at the same time, if you're announcing a committee and part of that committee includes medical experts that you are consulting with, it's more than just your typical committee. It's supplemented by people with medical and scientific knowledge, and making sure that the decisions that you're making aren't being made in a vacuum, and it's not what some might think of as a typical committee. In certain crises, a lot of times people like myself would stay behind the scenes from a communications perspective, because we can become part of the story, and that's not what we want. But at the same time, if we can be helpful in communicating out to audiences, especially because of all that's going on right now and hands are tied, I don't think that anytime that you can be honest and acknowledge what you're doing and what you're trying to do, a lot better than trying to do everything behind the scenes.
That's great advice. David and Linda, anything you'd like to add?
I think staying on the moral high ground is always important for the board. And if the board is, it should be transparent enough to say what it's doing and what it knows and what it doesn't know. It doesn't have to get into details about certain things. Boards have to be very careful, because so many of them are parents, and they have to remember their duty of loyalty, and their duty of loyalty is to keep what's in the boardroom, and what gets communicated has to be a board decision, not individual decision.
Absolutely. So, Linda, go ahead.
On the balance idea is following that focus in New England on the educator sexual misconduct. You saw a lot more communications between the boards and school administrators to their constituencies on here's what we're doing to maintain a safe school environment, trying to reassure parents that you were taking effective steps to try to maintain their safety. And I would envision that as this rolls forward and as steps are taking, also reassuring them, here's what it is we're doing, so that parents will make their decisions to say, yes, this is a school where I want to send my child because they're on top of this. And I think there is going to need to be some of that reassurance.
I think you're absolutely right.
Yeah, and Jennifer, I would say that, and to Linda's point, that's the bulleted portion of whatever letter that goes out. And I don't think it's never a bad idea to continue to reiterate all the things that you're doing from a safety and security standpoint.
Absolutely. And there's really no way here to satisfy every single constituent. Question we got is, what's our legal exposure? And I would say even maybe beyond just legal exposure, PR concern, value proposition, analysis. If the community doesn't agree with what the board and leadership ultimately decide, for example, the specific question was, what if you have parents who think you're opening too early, or parents who are frustrated that you haven't opened early enough? I think David's advice earlier about whatever you decide being well documented and vetted is probably where I would start. But any further thoughts about that? Knowing there's no way to make everyone happy here, but what's the best approach to take in trying to get as close to that as possible?
You have to protect the core, and the core are the students and paying students, and obviously their families and your employees. And this is my instinct, but my instinct is the most important North Star to follow, is that the majority of the families and the majority of the employees feel that what you're doing is right, and they're willing to buy into it and come back. And I think it's unrealistic to expect that everybody's going to come back. You're going to have attrition, and you may even have attrition of key employees. And even if you don't have attrition because they're not willing to come back, you may have them drop out from time to time if they become symptomatic. So you're going to have to plan for all of that. I think it's a matter of which strategy retains the most revenue, and by being safe.
I think you're right. Retains the most revenue, and taking it a step further, maybe the most goodwill on the part of the community. Everyone's acting in good faith, and if we clearly communicate that, that's the very best a school can do. Yes. I think that you're right about retention. That's a conversation we've been having a lot around the pandemic and the likely impact on enrollment. Hopefully not too negative, but we are sure to lose some students here. But whatever a school can do to support current families will help them in the long run. It's much easier to retain a current family than it is to attract a new one, especially in a time like this. On the flip side, independent schools have done such a great job pivoting during this pandemic and showing their value proposition, adapting to a new normal, that we have heard success stories from schools who have newly admitted families who want to start right now and not wait until the fall because they've been able to do this so well. So I don't want to make a blanket statement like that makes it seem as though you won't be attracting any new families in this market. With the right messaging and the right value proposition and program, you certainly will, but retention is absolutely key. We've gotten a lot of questions about some topics we've been covering in other programs, a lot around the PPP fund, the CARES Act, etc. I want you all to know that we are doing another program in that regard next Monday, and we're always here to answer questions about that. I don't want you to think those questions are going ignored, but I wanted to leverage the unique expertise we have on the call today to explore some other angles here. So in that regard, I know we've gone 8 minutes over. I would love to end with each panelist's thoughts on this one very poignant question, which is, how do the principles of leading and change management shift in a time of crisis? What ending advice would you like to leave attendees with today in that regard?
Well, I'm happy to start because that was my theme, and my theme is don't go it alone, administrators. You have a tremendous resource in your board, and remember, the board has a fiduciary obligation to support and protect the financial stability of the school. There's a lot of talent on the board. You can't do everything, and you'll get overwhelmed. And besides, your focus is appropriately administrative. And right now, administration means a very short-term focus. And schools, to survive, are going to have to change the way they do business for at least the near long-term future and maybe the long-term future. And that's strategic planning, and that's the role of the board. So that's my advice.
You're absolutely right. We talked about how a lot of the conversations and hopefully innovations that are going to come out of this really should have been on the minds of schools already, and that maybe the silver lining here is that the pandemic is exacerbating what will hopefully be some positive innovation and change in the long run, not only for the business model, but maybe the learning model and more. So thank you. Linda?
You know, I think the word shift isn't the word that I would use. I would say you rise to this. And so as a leader of the school community, this is your time to showcase why you are that leader and that calm, professional, measured, in control presence to say, I am leading the school. Here's what we're doing. And it's going to pitch in a minute to Philip, because I think it is a communication aspect to it, to say everything that you do all the time, the new measures that have been taken of, you know, the risk management committees that have been developed by the board to create that partnership that David is talking about, to be the voice of the school, the image of the school, what does your school stand for, and to rise to this and showcase that you have a wonderful school that parents should want to send their students to, and the measures that you're taking, and to communicate that to the audience. It's not a time to put your head in the sand and hunker down. It's the time to rise up and show them why you're the leader.
Absolutely. Thank you. And in that regard, Philip, would love to hear from you.
Yeah, and I would add to that, because there were two questions, one in particular that I answered in the Q&A in writing, but how do you communicate confidence? And the way I answered that was honesty and pragmatism, but with optimism and encouragement for the future. Like, we have an opportunity to manage expectations for the new normal. And like I said earlier, just because the school environment won't be as it was, that doesn't mean it can't be effective in educating and nurturing personal growth. And I would also say that there should not be any question about what your school has done to protect your students. Dr. Jeff and Dr. Schulke would say it a lot more artfully than I'm going to say it, but I've heard them say on other calls with clients, you should look at the CDC guidelines as the floor. And I think that applies really well to the independent and private school world, especially knowing the tuition that is associated with some of your schools. Your parents and your students are going to want to know that you have done everything possible. You should be able to look at yourself in the mirror and say, we have done everything that we can in order to keep our community safe. And I know everybody on this call has probably seen it, but there was a question about how do you manage the parents that are going to say we need to be open, and those that say we need to be closed? And I think the easiest way to answer it is to say, we won't know if we've overreacted, but we will know if we've underreacted.
Mm-hmm. Mm-hmm. Very well said. No one can blame the school for taking the approach that keeps their community safest, I think. So that's very well said. I know that we had a lot of questions that we weren't able to get to today, but I'm so thankful that we were able to cover almost all of the issues here, especially from a medical communication